And welcome back to live coverage of the 2026 Mackinac Policy Conference. Michigan's healthcare industry is facing a major workforce challenge with tens of thousands of open positions affecting hospitals, patient care, and the state's broader economy. Let's take a look at how business, healthcare, and regional leaders are working together to strengthen talent pipelines, expand access to healthcare careers, and address one of Michigan's most urgent long-term workforce needs. We're joined by Catherine Susko, VP at Henry Ford Health. Welcome.
Thank you.
We have Christi Taylor, Senior Director at the Detroit Regional Chamber. Hello.
Hi.
And Ed Siaje, President of Bank of America Detroit. It's so good to see you here.
It's great to see you, Zoe.
So
it's great to be with you
It's
ladies.
great to have
You
us
as
all
well.
here. It's all here. Catherine, let's start with you. You know, Michigan hospitals, my understanding, are currently facing 23,000 open healthcare positions statewide. What does this mean in terms of practical terms on the ground?
Practically, it means that we really have to build talent from within. We don't have access to talent in the public to really pull into the system in real time that's career ready. So it's innovative strategies, it's working with community partners, it's thinking outside of the box to make the most out of what little we have. From a functional standpoint, it's making sure that we can provide safe care, but it's also making sure that we provide access and quick access. So thinking about efficiencies, thinking about really putting our nurses at top of license for what we do in an operational setting every day, and really thinking creatively about training programs that we can bring to our workforce and removal of barriers to help build a workforce in real time.
Yeah, we're going to talk a little bit about that, but let's continue to set the table a little bit about staffing shortages. Where are they most severe right now?
I'd say in a lot of our nursing disciplines, it's probably our higher acuity areas. It's the programs that have limited seats in the state or that have limited access to actual clinical placements. So our CRNAs have been a really big challenge. A lot of our nursing disciplines have been a huge challenge. We've, in partnership, really worked to skill up our nurse assistant and medical assistants. So a lot of the nursing disciplines.
Yeah. Christi, tell us about the Detroit Regional Chamber's Healthcare Talent Collaborative.
Sure. So we launched in 2023 in partnership with Catherine and her team a regional collaborative made up of leaders from healthcare systems, K-12, higher education, community-based organizations who really came together to look at the data and recognize that we were in a crisis and then commit to some innovative strategies to address the crisis that we're seeing. The Chamber tries to respond to the business needs in the region. Healthcare is one of our largest industries, and we knew that we needed to be bold and address this challenge and bring together stakeholders from different sectors to really think collaboratively about how we might do that. So we look at, K-12 pathways into healthcare jobs. How do we get young people exposed to careers in nursing where there's a need, but also in respiratory therapy and other disciplines that they might not know about? And we're also looking at existing healthcare workers who are in entry-level roles who just need a bit more education and training to get to that next level and that next income bracket. And we do that in partnership with Henry Ford Health and a couple other of our health systems.
So what does that look like on the ground?
It's, we really start with the data. We look at the labor market data. Where is the highest need? We validate that with employers. And then we build strategies that any one sector can't implement alone, right? So we need Henry Ford Health to partner with our training providers to think about ways to better reach learners. For adults, that might mean on-site instruction, because if you work a full-time job and have responsibilities at home, getting to class on a campus isn't really viable. So how can we bring training to our instructors? For our K-12 work, we're trying to bring exposure opportunities into the classroom. So we have a program called Pathways in Practice where we bring healthcare professionals into classrooms at different high schools to do really fun, hands-on, interactive activities to teach them about different healthcare careers. One example, we had somebody from supply chain come into one of our classrooms and bring a simulation where there was a recall on like a glove, and the students had to walk through how do you manage a recall, and that they'll remember that, right? That's the kind of thing that really sticks with students, and we try to bring that type of learning to classrooms.
Yeah. Ed, Bank of America recently joined the collaborative as a supporting partner. Why has the business community become more engaged in healthcare workforce development? Why now?
That's a great question, Zoe. It's important because you can't drive economic growth or, when you talk about workforce development, it's about the people, right? And you got to get the people trained to find the jobs that they need, and you got to understand the gaps that are there to help make sure you can fill. And so for us, it's about the people, and it's about driving economic development, right? And the more we can strengthen people and get these great jobs and support our healthcare kind of initiatives, et cetera, the more we can strengthen our economy, and obviously that's good for banks.
It sounds like it's bigger than healthcare.
Oh, much bigger than healthcare. I mean, it's about the people, it's about sustainable jobs, it's about strong paying jobs so people can build wealth, and that's where we come in. So we look at all the problems that we see across the community, and we work to partner with the experts to help support and deliver that work.
Yeah. Catherine, healthcare careers often require expensive training, certifications, educational pathways. What barriers are preventing more people from entering the field right now?
I think the misconception that education isn't accessible is probably one of the biggest barriers that we're trying to fight and overcome. Exposure to the myriad of career opportunities you have within healthcare is probably another one from a student perspective.
Like there's too many options.
Well, there's a lot that you can do, and if you're only thinking you can be a nurse or a doctor, there's inpatient settings and outpatient settings. We are privileged to serve Southeast Michigan and over 550 sites of care, and that looks very different in each of those offices. I'll tell you from a socioeconomic perspective, childcare and transportation are probably some of the biggest barriers. A lot of our entry-level workforce are just one crisis or traumatic event away from housing scarcity and food scarcity, and oftentimes having to make tough decisions on gaining access to work versus putting food on the table. So removing those barriers and making education accessible one individual at a time is really how we've treated this, because it's not just about a job, it's a career. All of these positions, entry level or not, are on career pathways that we can support from a system perspective and from a regional perspective, continued development growth.
Yeah. Christi, I'm thinking about how all of this works towards the state's competitiveness, because again, it's not just about healthcare.
Yeah, we know that we have to increase post-secondary attainment across the board. We have to improve economic mobility. We have to really rally around Michigan as a destination for quality healthcare, for talent, for good jobs. And so this is just a natural fit for the Chamber's larger portfolio. And we were excited to see Bank of America come to the table, because I think it supports that notion that investing in talent improves our community. So whether you're a financial institution or a healthcare institution, we know that we need to net new talent into this ecosystem, and we need to create better economic outcomes for the region.
Catherine, I mean, this is a big question, I know, but I think one question people may be wondering is just how did we get here?
Oh, I think that's quite complex. I think that they set the stage at the start of policy this year in really the state of our region and the state of our state. And I think that there are quite a few components that contributed to the breadth of the problem that we have. It's definitely a challenge that we are 44th in reading in the nation. It's definitely a problem that industry was removed from education, and technology plays a role in that too. So being able to contribute to curriculum in real time, being able to contribute to technological advancements and ensure that that's what's being taught so students are career ready, are some of the solutions that we're deploying. But it's been quite a conundrum to get us here.
Yeah. Ed, what is success going to look like for Healthcare Talent Collaborative over the next, let's say, 5 years?
So I think it's obviously reducing the amount of jobs that are there and increasing our capacity from a healthcare perspective. But it's also looking at, our unemployment rate, for example, right? Right now, nationally, I think the unemployment rate's around 4.2% or so, 4.3%. But in Michigan or in Detroit specifically, it's like 5.2%. So it's higher than the rest of the country. So we want to reduce that. So that's what we're looking at as a metric. Obviously, the more high-paying jobs, these great careers, right, builds economic growth too for housing support, which we're prepared for, financial education and support. So we're ready to wrap around the services around these people that hopefully can get trained for these jobs, and we'll show up to help them with the rest of their financial journey. So we're going to cross a lot of different metrics on that, but for us it's the reduction of the roles that are open, I think is the easiest way to see it across the next 5 years.
One of the things that we've been talking about here at the conference is the so-called house on fire, right? That our metrics overall,
Yes.
Catherine, you brought it up, right, are not where they should be. The question is, I guess, then, do you think Michiganders understand that about healthcare right now and where we're at?
I do not think they understand it at all, to be honest with you, because I don't think that the message has been strong enough out there to make sure people understand where we truly stand as a state. Or even this information on 23,000, open healthcare jobs. By the way, we have gaps in manufacturing and in technology as well. So we're working with partners to do the same things in those spaces. But I don't think the average Michigander knows exactly how bad our house is on fire.
Yeah.
And this conference is a great place to get that message out and continue to deliver it so people know, and we can get everyone to lean in, because it takes a village. It takes the corporate world, it takes the nonprofit world, it takes, all these collaborations to really fix these problems.
Yeah. Well, thanks, three of you, for doing what you're doing right now. Catherine, Christi, Ed, thanks so much for the time.
Thank you.
Thank you.